Hello and welcome to Health City Talks. In this edition, we're going to talk about the Citizen Care Pod, an innovative approach to solving some of the challenges we're facing due to the COVID-19 pandemic. We're going to learn a little bit more about what these pods are, how they're being used for mobile testing, and also other applications like long-term care visits. My name is Mack. I'm the co-founder of Taproot Publishing. Every Wednesday morning here in Edmonton, we publish the Health Innovation Roundup, sponsored by Health City. And it's a curated email newsletter that brings together the latest headlines and happenings in the vibrant health innovation sector here in our city and in our province. Today, I'm happy to be moderating this discussion and to learn from all of you about this really exciting project. So let's dive right in. Our panelists are Zenon Radewych, co-founder of Citizen Care Pods, and also a principal at WZMH Architects. Welcome. Sean Barnes is the Vice President of Special Projects at PCL, based in Winnipeg there. Hi, Sean.
Hello.
We've got Mike Yorke, who is President of the Carpenters District Council of Ontario. Welcome, Mike. And we've also got Antonio Bruni from Health City joining us today. Hi, Antonio.
Hi. Hi, Mac.
Okay, well, let's get into the conversation. I want to know, first of all, from you, Zenon, what is Citizen Care Pod? Where did this idea come from? How long ago did it start? What can you tell us about the origin story?
Great. So let's start with when it all kind of started. So it was back, just pre-lockdown, so sometime mid to end of March. I keep forgetting now the exact date, but I was having a conversation late at night, like I always do with one of my clients, Carl DeMarco, who our firm and actually PCL working together on a very large development project in Toronto, not yet awarded, but we submitted a bid last summer. So one late night in March, we were talking, it was probably around almost midnight, and we were talking about, should we win that project? Should he win that project with ourselves and PCL? How are we going to make the site safe? How do we kind of, start this large construction project, in the middle of this COVID scenario and keep people safe? So we kind of thought about creating kind of like a bubble scenario around the construction site, gates and entry points and booths where people would come up and get screened and tested, right? So that's kind of how it started. And we were kind of brainstorming about, how we could do this quickly. And I kind of threw out the idea, well, let's think about maybe a sea container, converting a sea container. And so we then said, you know what, we got to call PCL right away. So I think the next day or 2 days after that, I called PCL, and I was speaking to one of the gentlemen in Toronto, explaining the idea, and he got all excited about it, said, okay, let me get back to you, Zen, and I'll talk to the rest of the guys, and we'll get back to you. And within the day, they called back and said, let's get on this. They were also already doing some other called COVID-related initiatives. So it kind of fell right in line with kind of other things that they were doing. And then, we thought, okay, if we want to bring some called smarts to this Citizen Care Pod, this testing booth at the time, or pod, let's call Microsoft. So we called Microsoft, and Microsoft jumped all over it and got all excited. So that's how it all started. And what it really is it's a repurposed sea container, 2 different sizes. They come in 20 feet or 40 feet. And we chose a sea container really for a few reasons. Number one, speed to market, because it's an existing called building, or a box that comes with a floor, walls, and a roof, and we simply cut holes in it, insulate it, and finish it off, etc. But it's also very durable. It's also very easy to move. Sea containers are made to move around. Lift them, slide them up in the back of trucks, put them on planes, trains, boats. So very mobile. So that's kind of what we chose as being the solution for this, smart screening and testing pod. And then we designed it in a way where, on the inside, it very much has laboratory finishes. It has, vinyl sheet flooring, gypsum board, FRP panels, stainless steel counters on legs, foldable legs, things like that, and many things that the Carpenters actually build for us in terms of, the things that Mike Yorke's group does. And so we created this great environment inside that's heated, air conditioned, it's pressurized, it's ventilated. So it really creates a safe environment for the frontline staff. We were seeing a lot of things that were happening in terms of tents and pop-ups that really didn't look very safe. And when they were being installed at end of March, early April, when the weather was kind of changing, being a bit more warmer, that maybe made sense. But that, we were thinking, well, it's not going to last very long. And with wind and rain and snow and ice, all that kind of stuff, we have to have something that's more more of a building and a safe building that keeps people inside very comfortable, so that they can do their job very efficiently. So that's kind of the whole story. And literally we spent, about a weekend drawing up some sketches, handed over to PCL, and within like weeks, PCL had built 4 of these pods already. So from concept to the 4 initial pods was, maximum 3 to 4 weeks. It happened so fast. The team was amazing. A lot of collaboration, actually a lot of fun in those great times when COVID came out. So it was a fun project.
That's awesome. And I see these sea cans and these intermodal containers used all over the place. They're used for outdoor markets now. I've seen housing projects built with these things. It wasn't, I suppose, a surprise to see that selected for this kind of an application, but it also seems pretty smart. Where can people see these now? Are there any of these deployed? You mentioned these 4 prototypes. Like, where would somebody come across one of the Citizen Care Pods?
So there's a number of them have been already deployed. There's one that was recently, when I say recently, over a month ago now, deployed and installed at University of Denver. There's one at the Carpenters in Woodbridge in Ontario. There's a unit that was recently deployed to Las Vegas by a company called Connect Us Global. So there's one in Vegas. There's a pod that PCL are using, I believe, at a construction site out in California near UCLA. There's another pod that was sent out to Michigan, to another location that PCL delivered for, I believe, like a homeless shelter scenario. So there's still
in Grand Rapids, Michigan.
Yeah. And currently we're doing one for an airport. I can't mention because we're under NDA, but for an airport in Western Canada. So they're slowly being deployed really across North America. And we're talking to clients actually throughout the world, South America, some clients in Africa, some in Australia. So it's really starting to pick up right now.
That's really exciting. Okay, I want to learn a little bit more about some of these that are out in the field. But first, I just want to bring you into this conversation, Antonio. So tell us a bit more about Health City's interest in a mobile testing pod like Citizen Care Pod.
Yeah, absolutely. Thanks, Mack. I think, looking at this concept, Health City very much, enjoys the idea of innovation being born out of necessity. And we very much admire these types of coalitions or partnerships that come together with disparate groups. And I think this is a fine example of that. We see that the COVID pandemic hit, and we saw these groups mobilize together to deliver this novel innovation. And I think what Zenon shared, we're hearing about these applications being applied across diverse applications. So we're seeing it not just with respect to pre-COVID testing, screening areas, but also their applications in other areas like post-secondary institutions. So I think there's a lot of opportunity where these can be deployed in remote and rural settings and make applications towards healthcare. So we definitely want to help get this message out with Citizen Care Pod about what they're doing and the value that it can add, not just in response to COVID, but through other applications as well.
That's great. Well, let's find out about one of those applications. So Mike, I'm curious to know about the Citizen Care Pod that you've got and what the experience has been like there. You're in Toronto, I think. I'm in Edmonton, so we're in the bubble cities for the NHL. But you've got a pod now, so tell us a bit about that.
Well, you know what? I think Zenon did a great job of just giving the overall description, a little bit of the track record, and a bit of the background and context to this. And when we were discussing that with Zenon and his partner Carl, we know that we had to have a safe return to work and return to school for our students. Like currently, although we have 5,000 members that are apprentices going through the system, our training center can typically handle probably about 150 students per intake session in pre-COVID time. Right now, with COVID, we're down to about a third of that. So we maybe have maximum 45, 50, 60 students. So we had to build new classroom facilities. We had to have all kinds of protocols put into place. Certainly, one of those protocols was screening of the students, the instructors, and any guests that come to the college on a daily basis. And as Zenon had mentioned, through the summer, we did have a tent set up, and students would come through each morning at 7:30, be screened for COVID. But as the weather started to change, we know that we needed something different. And this particular citizen care pod came available to us at exactly the right moment. So for a couple of reasons. One, we wanted to model good behavior on the part of the union. We wanted to have something more sophisticated, professional, and efficient than just a tent set up in the parking area. So this really came about at the right moment. And as Zenon had mentioned, look, it's very safe for the young woman that does the screening on a daily basis for the students. It looks professional. And it also, like I said earlier, it models good behavior. So we've reached out to other colleges. We've had tours offered to Chair of the Board of Health of Toronto, City of Toronto. We've had people come through from various hospitals to see what it could look like. We've invited the local political leadership here in Vaughan to come through and see what's, it's not the model for everyone, but it's certainly a good example of what's possible if people collaborate and take health and safety as a priority for their clients, in our case, our students, but it could also be patients at a long-term care. It could be folks that have to visit the city hall. So we thought this was an appropriate step for us to take. By the way, it's also a great model of built in Ontario, made in Canada, supporting our manufacturing base. So it's it hits a number of benchmarks for us that we felt were very important.
Yeah, absolutely.
Do you mind if I add something to that?
Yeah, go for it, Sean. Yeah.
Mike brought up a couple of interesting points that kind of dovetail into some of Zenon's initial comments about starting off with tents, right? And migrating to a portable solution that's a bit more permanent based, right? So we're taking these containers and modular construction and essentially building a facility inside these containers that's built to like a hospital isolation room standard, right? And you can deploy and put anywhere and move it. And what we've been hearing from a lot of potential clients to this point is they've looked at temporary solutions because they believe that this was going to be something that they could get through, and then we would be getting back to normal. And what people are realizing is that's not happening. Right. And so, you know, here we are going, okay, winter's coming, you know, whether it's tents or trying to do testing outside, people are starting to see some real problems with that. My apologies. And that's why, you know, this solution is definitely gaining a lot more traction now than maybe at the beginning of the pandemic.
Yeah, no, that's interesting. So heat is a big factor, it sounds like, but just what are some of the other features of these citizen care pods? Like, what are some of the other, like, how do they actually work? Maybe Zenon, for you.
Yeah, so actually, I'll answer that question, but just kind of getting back to what Sean just mentioned, which will partially answer your question, is, you know, if you look at, you know, what's happening out there in terms of, you know, testing and screening, whether they're using tents or they're taking over space in some sort of building, you know, it's more than just somebody walking up and getting a test, right? Yeah. There's equipment, there's files, there's forms, there's supplies, there's all these things that these frontline staff work with, right? Hanging up their coat, for example, and stuff like that. Where do they put their lunch, right? So when you think about it, by creating this sea container, this pod, and putting inside there, now these, you're asking a question about what other things, how do they work? Well, inside we have counters, we have cupboards above, below, we have coat hooks, we could put in sinks, like we have all these things that are placed inside this unit that's very, call it, you know, compact boutique. It's all there, very efficient to access, plugs, receptacles, to plug in laptops, all that kind of stuff. So it makes the whole process that much more user-friendly, safe, efficient. You know, actually, last week I went for a COVID test in Toronto at a hospital. I'm not going to mention which one, but I was actually surprised how inefficient the process was, how many people you have to actually go through before you get your test. And I think that was all a result of just them not being called very organized in terms of the flow process. And I was thinking, you know what, this is an example of just how people potentially get contaminated and pass on the disease because you're going through so many people. In our solution, there's a window that separates the frontline staff from the person walking up. You could plug in technology at the window, a tablet, where you could fill out all those forms in front of the person while they're talking to you or asking questions, and then get your test. And they're passing stuff to people behind them in the unit, again, physically separated from you. So, you know, this solution is more than just making this thing mobile and portable. It's about making the whole process more efficient. And again, a lot of emphasis on safety. We're really kind of cutting down the amount of interaction you have between the person being tested and all those frontline staff that support the process, because it's more than just one person that sits there and takes your test. There's other people behind the scenes, and we kept
value propositions. And did you want to talk to that a little bit more? Just, you know, the fact that whether it's a nurse or whoever the person is that's actually doing the test is inside the unit, and you know, we've got the windows with the alligator arm gloves that you can use. And so instead of seeing people that are outside head to toe in PPE that has to be changed out at quite a frequency,
Right.
you're protecting the people that are doing the testing, and then and making the entire process the testing process that you're going through far more efficient. So I don't know if you want to add anything to that, Zenon.
Well, I mean, I think you covered it off, but you know, the whole idea is again about, you know, creating this physical barrier. You can reduce the amount of PPE, and again, you know, really kind of create this safe environment. The units are pressurized, so I mean, I always confuse negative versus positive pressure, but the simple way to explain it to the audience, people listening, is when you're inside the unit and there is an opening in the glass, say, to pass something through. If you're on the outside, you'll feel the air kind of flowing in on you. Meaning, if you're outside and you were coughing for some reason, you know, being a pressurized unit, the air from the inside the unit is blowing out and will push those contaminants away from the unit. So there's a lot of safety features that are built into the unit to make it, you know, again, that much more safer than what we typically see, you know, right now with tents and or the converted lobbies of a hospital or of an administrative building or a community center, right?
Yeah. Okay. That makes a lot of sense. I had a COVID test myself last week, and it's a ton of PPE involved and a ton of different stations along the way. So any way that you can streamline that sounds very, very appealing for frontline workers and for the patients as well. I want to talk a bit more about some of the other applications, because it's expanded beyond mobile testing now, I understand. But first, I just want to get you, Sean, to explain a little bit more about the construction side of this thing and what's PCL's interest in the Citizen Care Pod. And is 4 weeks from, or the short amount of time that Zenon mentioned to get from prototype or idea to prototype typical, or was that a Herculean effort on your part?
I wouldn't say it was a Herculean effort. You know, Zenon might disagree with me there. The reality is, you know, once you have the concept and you've got a group that's working collaboratively together, both design and in construction, you can accomplish things very quickly. And so, you know, we're the largest general contractor in Canada, and hospital construction is an enormous piece of our business. And we also have, we look for opportunities to incorporate modular solutions into our construction projects. And so this is just kind of an extension of our core business in building modular solutions, right? If it's a hospital and you can repeat certain things within a facility, if you have the same design for a washroom or a medical headboard or different things within a hospital, and you get to a critical mass of a certain amount, we will automatically look at whether or not we can build this offsite in a factory, for lack of a better word, and then deliver it to the site and install it in the field, right? So allow our tradespeople to build in an enclosed condition outside of the elements, and then bring that product to the site, and it enables us to have a higher degree of quality control. And when we have quantity and we can repeat it, you know, it allows us to do this. And so as it relates to the pods, we use the sea containers for all sorts of things in our core business to begin with, and we're seeing more and more applications. I think Antonio started out and talked about some very creative things that you're seeing single-use sea containers used for, and we're one of those companies that's looking for those sorts of opportunities and doing it. And we have a long-standing relationship with WZMH, Zenon and his company, and it was just a natural thing for us to collaborate on this initiative.
Excellent. Okay, well, before we run out of time, I do want to ask about some of the other applications. So the first was, it sounded like mobile testing, but now I understand there's also a version of the Citizen Care Pod that's used for long-term care visits. So Sean and then maybe Zenon to add, do you want to talk to us a little bit about that application?
Sure. So you want me to go first, Zenon? I can talk to that.
You go first.
Okay. So what was interesting is when we initially built the prototypes and we'd come up with this concept, and we because we're active in the healthcare industry, we had reached out to different health authorities across the country to share information as it relates to this to the citizen care pods. And in Manitoba, we received a call, I think in April, from the province of Manitoba as an outreach back to us, saying we really like what you've come up with as it relates to the citizen care pods, but we have a very specific use case we think that this idea would work well for, and that was looking for an opportunity to provide visitation at personal care homes between residents and families, and protecting some of the residents, just given what's been happening across the country in personal care homes. The province of Manitoba was looking for a solution to allow for residents to be able to visit with their families, and also protect them and people that are working in those facilities. And so when we were asked about that concept, I connected with Zenon. We worked on a couple of different options. We helped the province wrap their heads around logistics and how they could pull information from 124 personal care homes in the province to make that work. And then they turned around and they took that information, and I'm sure they talked to some other companies and put together an RFP in which we responded to, and we were successful in getting it. And Zenon can talk to the design. So there's 107 of these that are being deployed across the province of Manitoba at different personal care homes. I think we were awarded the contract in August, and we will be finished next month. So this is something that's turned around incredibly quickly. But the concept is very interesting, right? And maybe I'll turn that over to you, Zen, and just how they're designed and how they protect both the resident and the people that are coming to visit the folks in the personal care homes.
Great, yeah. So the concept is pretty simple. It's a 40-foot sea container, and we simply took half of it, 20 feet, to create the actual room where the patient or the resident visits their actual family members, and 20 feet is kind of the right number to have them sit at one end, have a safe gap in the middle, and then the seats at the other end for the visitors. And then the other 20 feet is an actual called tunnel, or it's the hallway connection that leads to the actual a long-term care home or patient care home. And within that space, actually, we were able to kind of hide and cover up all the mechanical systems. Again, there's a lot of ventilation in those units. I think I have to really kind of take my hat off to PCL, because that particular project, as Sean mentioned, when they came to us for it, they actually were really hands-on, and PCL very much drove the design process in terms of how they're going to build this thing. Even the mechanical design, it was very collaborative. And then PCL also brought on board a very large firm, Stantec, who kind of took over and delivered it for us in Manitoba. But it was very collaborative. It was very hands-on. It was literally over a period of about a week and a half that we kind of figured out everything from A to Z, how it's going to all work. And it was very much driven by the PCL team. So really hats off to them for making that happen.
There's an army of craft labor out there right now. Mike, you'll be happy to hear that. That's putting all of those together. Every day, 4 of them leave this facility.
Wow.
Super fast.
Yeah, that's fantastic. And then I'll have a big impact for people throughout the province. And then I'm sure is a great test case for future applications as well. So just to wrap up here, Zen, and I want to come back to you and just hear a little bit about where you see this going. So obviously this was, as Antonio mentioned and you mentioned at the start, born out of a need, a necessity here in the pandemic, but and the pandemic is going to be with us for a while still, even when we get a vaccine. It's not going to go away anytime soon, but it'll end at some point. Where do you see the future of citizen care pods going?
So I think first and foremost, one thing that's important to note is when this whole thing started, we were getting together almost on a daily basis, WZMH, PCL, Carl DeMarco, Microsoft, different team members. And through that collaboration on a day-to-day basis, our heads were basically thinking, and a lot of, creative juices were flowing. And so we were already thinking back then in the early days about what are the other uses, what are the other things that we can do, right? So for example, we came up with this idea about school portables. So we came up with a school portable solution. And we've talked a bit about the long-term care solution. We also gave solutions to deploy these units outside these, where a portion of the unit could be used for testing and screening, and believe it or not, a portion could be used for retail, for quick retail where you walk up and you could buy a few things without having to enter the store. So it's grown, to your point about where it's going. It's grown from smart screening and testing to other uses, and we really see the future of this being, as you mentioned, not only to kind of smart screen and test for COVID, but eventually administer the vaccine, support the administering of the flu shots, because that's also big right now. And then also being ready for deployment for the future of call it any other pandemic that might happen. I mean, being a sea container, it's very easy to pack up, store away, and pull out if you have to pull it out in 5 years. So there is a called long-term strategy where these can be used for much longer than just the end of COVID, which is probably still who knows, a year away still, right? And we're even looking at educational pods where you could use the unit itself to not only do these things about COVID, but maybe also start to kind of educate the people that are coming up to get tested about proper hand washing, all those things to kind of change the way they do things on a day-to-day basis moving forward. So it'll have a life that'll go beyond just COVID.
Yeah, that makes a lot of sense. Well, I'm glad you've been thinking about that, and congratulations to you and everybody on the team who's worked on these things for such an exciting project. I've really enjoyed learning a bit more about Citizen Care Pod today, and I hope all of our viewers and listeners have as well. Thanks once again to Zenon Radewych from Citizen Care Pod, Sean Barnes of PCL, and Mike Yorke of the Carpenters District Council of Ontario. Antonio, any final thoughts from Health City?
No, thank you, all of you, for your participation today, and definitely looking forward to following the successes of Citizen Care Pod. And it's such a wonderful collaboration, and the power of partnership is definitely evident just in this initiative alone. So congratulations on the work.
Thank you.
Our next episode of Health City Talks is also going to talk about Citizen Care Pod in a little bit more detail, so you can check that out on the Health City YouTube page, or check out Health City online as well for more. I'm Mack Mail. Thanks everyone for joining us, and we'll speak with you again soon.
Thank you.
Thank you.